What is framework analysis? Framework analysis is a qualitative research method used to systematically organize and analyze data. It involves a structured process to categorize, chart, and interpret data in a way that highlights relationships, patterns, and themes. Unlike other qualitative methods, framework analysis is highly systematic and allows researchers to manage large datasets efficiently. This method is widely used in applied research fields like healthcare, policy development, education, and social sciences. When to use framework analysis? When managing large datasets with multiple participants or sources, to address specific research objectives or questions, for applied research in policy making, healthcare, or education. Applications of framework analysis: healthcare, studying patient experiences or evaluating healthcare delivery systems; policy development, analyzing public feedback on policy proposals; education, understanding student or teacher perceptions about learning environments; social sciences, exploring social behaviors or cultural phenomena. Example of framework analysis scenario: a researcher wants to study the challenges faced by students in online learning, familiarization, review student survey responses and interview transcripts. Thematic framework: develop themes like technical barriers, teacher support, and peer interaction. Indexing: assign responses about internet issues to the technical barriers theme. Charting: summarize key points under each theme, such as unstable internet or difficulty accessing resources. Mapping and interpretation: analyze the relationship between technical barriers and student engagement to make recommendations for improvement. Number 1. Familiarization. Definition: the initial stage where researchers immerse themselves in the data to gain a comprehensive understanding. Technique: reading transcripts or field notes multiple times, highlighting key points and recurring themes. Example: reviewing interview transcripts of patients discussing their healthcare experiences. Number 2. Identifying a thematic framework. Definition: developing an initial framework based on key themes, issues, or concepts identified in the data. Technique: coding text to create a thematic index, using research objectives to guide the framework's structure. Example: creating themes like accessibility, quality of care, and communication for a healthcare study. Number 3. Indexing. Definition: applying the thematic framework to the data systematically. Technique: assigning codes or labels to segments of text that correspond to themes in the framework, organizing data under relevant themes for easier retrieval. Example: indexing sections of interviews where patients discuss waiting times under the theme accessibility. Number 4. Charting. Definition: rearranging indexed data into a matrix or chart for each theme. Technique: summarizing and organizing data into rows, cases, and columns. Themes: creating visual representations for clarity. Example: charting patient feedback on quality of care across multiple hospitals. 5. Mapping and interpretation. Definition: analyzing the charted data to identify patterns, connections, and key insights. Technique: exploring relationships between themes and subthemes, identifying overarching conclusions or recommendations. Example: mapping connections between communication issues and patient satisfaction in healthcare.